the flow of the liquid through the artery will increase by the fourth power of the increase of the radius. If the radius goes up, if it dilates by a factor of 2, the blood flow goes up by a factor of 2 times 2 times 2 times 2 by a factor of 16 to the fourth, 2 to the fourth power. So as a result, you get dramatic improvements like this due to Poiseuille's law. If you can get those plaques to melt away a little bit and the arteries to dilate just a little bit, then you get dramatic increases in blood flow. Here's a cardiac perfusion scan. This is a heart muscle really deprived of oxygen. Red is good blood flow. You can see how little of it there is. This man went on a whole food plant-based diet for 2 weeks. The salads and the soups and steamed veggies melted the plaques in his coronary arteries away a little bit, dilated the blood vessels in the heart muscle a little bit, and this perfusion scan turns into this perfusion scan. In just 2 weeks, the changes are so profound. You get to read encouraging stories like Dr. Frey Ellis published. I read this in 1977. He described a 65-year-old man with severe angina. He had to stop every 9 or 10 paces. Went on a plant-based diet. 6 months later, his arteries opened up and he's climbing mountains in the Lake District of England with no more angina pain. Arteries all over the body open up, much to the delight of people at home. So, Dr. also said, you're as old as your arteries. And man, if you keep those arteries open and supple, you are a young or youngish person, and you're going to enjoy a vigorous life because of that. Now, a lot of people get all upset because of their but I got a calcium score of 400, doctor. What should I do about this? Yeah, what do we do about these calcium deposits in the walls of the arteries? Does that mean you're going, I got a calcium score of 400, the patient, my cardiologist says I'm going to die soon. No, you're not. What do these calcium deposits really tell us? Here is my viewing of these plaques. When there is chronic inflammation in the body, when tissues are chronically inflamed, and the body can't deal with the source of the inflammation, eventually it gives up and it just packs the inflamed tissues full of calcium. It just petrifies them. If you've got a tendon rubbing over a bone spur there and it's getting irritated, eventually the body will pack calcium into that tendon. You'll get a calcific tendonitis. If you have a cushioning bursa over a joint that's getting chronically irritated, after a while the body packs it full of calcium, you get a calcific bursitis. The body will pack calcium into any chronically inflamed tissue, including the arteries of the heart. Because atherosclerotic plaque formation is an inflammatory process, after a while, as the years go by, the body gives up and just packs it full of calcium. So this man had that inflammatory fire of atherosclerosis burning in the walls of these arteries, clearly, and the body packed it off. But what does that mean for him today? What does that mean for you today? I view it like this. A few years ago, went to the Gettysburg National Battlefield Monument in Pennsylvania, where they fought the big Civil War battle. And you go into the visitor center, and there's this huge diorama display, half the size of a tennis court. And there's thousands of little plaster soldiers on the diorama, half of them painted blue and half of them painted gray for the Union and the Confederacy. And these are soldiers, so they're in their battle poses with their bayonets and their swords and their pistols. And they're portraying the battle. But what are these plaster soldiers? They are plaster soldiers. They are frozen in time. They are remnants. They are reminders of the battle past. And that's what these flecks of calcium are in the artery walls. They are signifiers of that inflammatory fire that was burning the arteries in the past. But it does not tell you what is going on in your arteries now. It says your body successfully walled it out. It says you're capable of that inflammatory fire of atherosclerosis burning in your artery walls, but it doesn't tell you if it's happening now. And that's all that matters, because these calcified plaques do not rupture. They do not pose any threat. They're a marker of what was happening in the past, but it's the soft plaques that rupture and cause the clot that stops the blood flow in the heart. And those soft plaques do not show on the scan. So if you've got a calcium, okay, fair enough. And actually that calcium is doing you a favor. It's stabilizing those old plaques, but it's not going to go away. Your calcium score is not going to go down. You'll want it to go up. Might go up a little bit because there's an inertia that keeps going. As you change your diet tomorrow, you're going to have continuing inflammation for another few months or a while longer. So the calcium may continue to accumulate, but the threatening atherosclerotic plaque formation will be arrested. And this does not necessarily say that you're at high risk if you go plant-based. Show me the science. Well, if you do searches on plant-based diets and angina and claudication, you will see that now we're getting lots of studies showing up describing the reversibility of plant-based diets, the reversibility of atherosclerosis to be reversed by plant-based diets, and where are we going there? Okay, and here is what is high blood pressure will improve on a plant-based diet, congestive heart failure, kidney failure, a plant-based diet for kidney disease. It's starting to happen. Show me the science. There's now getting to be more and more solid science behind saying we are plant-eating hominids, follow that diet, and these diseases often reverse. Now, can you be a vegan and still get this disease? Absolutely, you can. I've got 2 male patients, long-term vegans. They're vegans for the animals, but one is overweight. He's a baker. He can't stop eating the baking and eating the vegan cupcakes and donuts and cookies. And the other one's a bachelor. He says, "Doc, I live on peanut butter and fruit juice. I drink gallons of fruit juice every week." And both of these guys developed official coronary artery disease. My overweight baker already has 2 stents. My fruit juice guzzler may have to get a bypass. So we need to talk about that. So when I hear, "Oh, I knew a vegan and he got heart disease," first of all, how long has he been vegan? If he's been eating a standard Western diet for 60 years and he's just been vegan for a year, I'm not surprised that his arteries are no longer pristine. It takes quite a while to reverse it. So when you hear, "Oh, a vegan got heart disease," well, how long has been vegan? Vegan since birth. You raise a child from birth on a whole food plant-based diet, their arteries will remain pristine. This process will never happen in a person who's been raised on a whole food plant-based diet all their lives. So I have to ask, what were they really eating? Was this a vegan junk food diet filled with free radicals and advanced glycogen end products damaging their artery walls and oxidizing their cholesterol? Then what was their stress level? Are they strapped for money and family problems? Because walking around with high cortisol levels from stress is not gentle with your artery walls. Are they hypothyroid? Low thyroid function will raise your cholesterol and possibly put you at risk for this. And because a vegan diet can be low in iodine, are we looking at subclinical hypothyroidism from an iodine deficiency? Make sure there's a good source of iodine in your diet, sea vegetables or a supplement. Now, if you don't have enough B12, a substance called homocysteine is going to start building up in your bloodstream, and that can damage your artery walls. So it's another reason, besides your nervous system, is not to neglect B12. Don't just blow that off. It can come back and bite you. And one way it can is a heart attack and stroke spawned by high homocysteine levels there. So make sure that's not an issue for our vegan who developed clogged arteries. And finally, if all of these are negative, nope, I've been plant-based for 40 years, and no stress, normal thyroid, normal B12, there's some evidence that in some people, at least some of this inflammation is set off by an infection with an organism like Chlamydia pneumoniae, H. pylori. And if all of these are negative in a vegan with heart disease, I do antibody PCR testing for these organisms, make sure that's not really what's setting this off. Because if so, then the course of antibiotics might really be helpful for this person. So for those rare vegans who do run afoul of this disease, again, it's largely diet or thyroid or B12 issues, but worthwhile thinking about the infection. Okay, so that's how cardiology can be positively affected by a whole food plant-based diet. If you want to learn more about it, go to my website, drklaper.com, and see my video called Beyond Cholesterol. And I go through why vegans with high cholesterol are not necessarily in any danger. They do not necessarily need statins. If you're a vegan with high cholesterol, do yourself a favor. It's a short video. Go to drklaper.com and find my, under resources, find my video Beyond Cholesterol, and it'll put your mind at rest. While you're there at drklaper.com, I invite you to download my health supporting eating plans, a 4-page handout to get people started. It gives them lots of videos to see and hints to how to lose weight, etc. I could spend 2 lectures on just how each one of these organ systems benefits from a whole food plant-based diet. And I can assure you that there's plenty of protein. A healthy eating day of plant-based food can easily give you 80 or more grams of protein. I've never met a vegan who's eating a diet based of these whole foods to be protein deficient. People say, well, it's expensive to eat this way. No, it's not. The truth is the staple foods that provide the calories and the protein, the rice and the beans and the lentils, they're cheap. You can buy a 10-pound bag of rice for a little over $6.50. You can buy 10-pound bags of lentils for a little over $12. Well, that's a month's supply. If every day you have 2 cups of rice and 2 cups of lentils in some form, a soup or a rice and lentil dish or whatever. But 2 cups of rice and 2 cups of lentils will give you 46 grams of protein. If you kick it up to 4 cups of rice, they'll give you 53 grams of protein. And it's pennies a day. And the Food Assistance Program pays for this. So for people who say that I can't afford it, if you buy the grains and the legumes in bulk, it becomes cheap. You can make up a stew or a chili that lasts for days and feeds a lot of people. And if you're not putting out money for steaks and ice cream, you've got money to buy organic broccoli and sweet potatoes. Okay, let me talk about one last disease about how plant-based diet actually reverses this disease. We're talking about type 2 diabetes. This is such an important study here. Back in 1927, Shirley Sweeney took medical students. He's a physician teaching medical students. He took medical students from his class and divided them up into 3 groups. And one group, he fed a high carbohydrate diet. The next one, a really high fat diet. The high carbohydrate diet folks were just eating for 2 days. Sugar, candy, pastry, white bread, baked potatoes, maple syrup, bananas, rice, and a high carbohydrate diet. They did, and after 2 days of that, they did a glucose tolerance curve where they had them drink 100 grams of glucose, and 2 hours later, they checked their blood sugar. And 2 hours later, the vast majority of these young med students, they were all back down, below 110 range, which is back basically to normal after 120 minutes. After 2 hours, their blood sugar back to normal. A high carbohydrate diet did not make them diabetic. They were able to handle more sugar quite easily. But the folks who were eating the high fat diet, and then for 2 days, all he let them eat was olive oil, butter, mayonnaise, egg yolk, 20% cream. Okay, this is a high fat diet for 2 days. He did a glucose tolerance test on these guys and girls, mostly guys back then in med school, gave them a 100-gram drink of glucose, and 2 hours later checked their blood sugar level, and virtually all of them were in frankly diabetic range. They were all in the 160 or higher range. After they all had a diabetic curve after 2 days of fats. It's not the sugars, it's the fats that lead to insulin resistance. How does this happen? Well, most sugar is burned in the muscles and the liver. So here's a muscle cell. It burns glucose. You eat an apple and glucose shows up in the bloodstream. You got to move the sugar into the muscle cell to burn it. But if the person's been eating a standard Western diet and keeping the blood full of fat hour after hour, as the days go by, the fat oozes into the muscle cells, start accumulating there as intramyocellular lipid. There's fat in the muscle cell that starts blocking the insulin receptors. This is not theoretical. Here's what it looks like under the light microscope. Now, this is striated muscle tissue, and all this black stuff, this is fat in the muscle cell. This is intramyocellular lipid in the muscle cell, does not belong there. Under the electron microscope, again, this is fat in the muscle cell, doesn't belong there. This is intramyocellular lipid. What is it doing? Why? How is it causing the problem? Well, here's what normally happens. Sugar shows up in the blood. The pancreas puts out insulin. The insulin plugs into the insulin receptor on the muscle cell. And when the insulin plugs into the insulin receptor, that activates two kinase enzymes symbolized by this K and this K. And when these kinase enzymes get activated, that turns on the GLUT4 mechanism that pulls glucose into the cell through a vesicle mechanism. This is how sugar enters the cell normally, but insulin has to turn on these two kinase enzymes. Well, if the blood has been all fatty and the cells are full of intramyocellular lipid, then what you have is this situation. The fat is built up in the mitochondria. They're getting oxidized. They're full of free radicals and generating ceramides. And the oxidized ceramides and free radicals inhibit these two kinase enzymes. So insulin knocks on the door, but nobody answers. Nothing happens. And as a result, the GLUT4 mechanism is not activated and the sugar piles up in the bloodstream. And you got high blood sugar. Ooh, don't eat sugar. The high sugar is the tail of the dog. That's just the effect. The problems is fat in the diet, clogging up the enzymes needed to pull sugar into the cells. If you want to read about intramyocellular lipid and insulin resistance, there is an increasing literature on it. And if the person happens to be obese, that adds another layer of insulin resistance. How? Because the fat in the abdomen is metabolically active. The visceral fat puts out inflammatory cytokines like interleukin 1 and 6. And here we are back in the muscle cell. Here's the intramyocellular lipid clogging up the enzymes of the insulin receptor. But here comes those inflammatory cytokines from the obese abdomen, and they interfere with the insulin receptors from the outside. So no wonder so many obese people develop type 2 diabetes. Those insulin receptors are clogged from the inside and obstructed from the outside. Well, is the answer just more insulin and more metformin? And how about Ozempic or Jardiance that makes you pee out your sugar in your urine? Is that the answer? No, it's not. This is a completely reversible disease. If you still have a functioning pancreas, this should be a completely reversible disease. You stop the meat and the oils and the dairy and the AGEs and all that stuff. And you go on a diet based on whole plant foods. And what happens? Well, the fatty onslaught stops. The muscle cell still needs energy. It looks around, hey, I've got energy already in here. Look at all this fat and this myocellular lipid. Well, let's burn that. And the stored up intramyocellular lipid gets thrown into the mitochondria and burned for energy. And as obesity begins to melt away, the inflammatory cytokines start fading away. So the insulin receptors open up and find that they start working and the diabetes starts going away. And here's Barnard's classic study where they compared a low-fat vegan diet and the conventional diabetes diet. And the folks on the low-fat plant-based diet had a greater improvement compared to the Diabetes Association diet. They had a better improvement in their hemoglobin A1C. They lost more body weight. Their lipids improved more. Their kidneys healed. They lost less albumin in their urine. And all of us who practice lifestyle medicine have patients like Jim in our practice who used to be 100 pounds overweight on 30 units of insulin. He went on a whole food plant-based diet, lost the weight, lost the insulin, and now he's running marathons diabetes-free. This should not be the exception. This is not standard results. These are standard results. And they're within grasp of every patient who is struggling with type 2 diabetes. It forces the doctor to learn a lovely skill called deprescribing, how you learn to back these patients off their insulin and metformin, et cetera. And show me the science, do the searches, you'll see, and come back. This is recorded, so come back and stop the video here and look up these studies here documenting how reversible type 2 diabetes can be. Obesity melts away This diet is mostly fiber and water. The calorie density is so low. How many apples can you eat? How much salad can you eat? How much vegetable soup can you eat? It's mostly fiber and water, and it winds up melting away excess fat without having to count calories or restrict your carbs or anything like that. Inflammatory arthritis, it's an anti-inflammatory diet. I don't have time to go into the mechanism, but that often improves, including rheumatoid arthritis. And if you're struggling with autoimmune diseases like lupus, I urge you to get a book called Goodbye Autoimmune Disease by Dr. Brooke Goldner, a physician who put her own lupus into remission with a plant-based diet and green smoothies. It's just a gift to us all. And she does consultations. You can connect with her.